Namaskar, good evening, salam, sat shri akal. Once again, I welcome you all to Dr. Seema Pandey's talk show, and we have come up with some small shots for people who are struggling with various lifestyle related problems. According to me, 80% of the diseases and problems we are facing in our life is because of the faulty lifestyle choices we are opting for, be it infertility, be it your cardiovascular health, or your obesity, or your bad cholesterol. Everything is related to what are we doing in this 24 into 7 world where we are not stopping at all. We are not letting our biological clock to work at its max. We are compromising with our choices. Today, I have a wonderful panel of people, experts from their own fields, who are going to discuss these problems and what are the best ways, shortest way to treat and handle these issues. To moderate this talk show today, I have my best friend, Dr. Anuradha Khar, as my co moderator. I welcome Dr. Anuradha, and I would like you to introduce yourself before we open to the panel.
Good evening, Namaskar. I'm Dr. Anuradha Khar. I am an IVF specialist in Bangalore, and today we are all together for this, current topic: lifestyle changes and their impact on infertility. Around 80 million women and 20 to 30% everywhere will having problem in conceiving. 50% within countries and even in India. Infertile couples suffer emotional, psychological pressures from the society. They feel incomplete if they don't have a child. Now, lifestyle want to tell in short that these refer to the modifiable behavioral
So, to can and all of you hear Dr. Anuradha Khar?
No, actually, no.
Yeah.
Okay,
Uh,
so by the time Dr.
yeah.
Anuradha
My
just
first question goes, she there has been
Dr. Anu will
Dr.
just
Arshi,
take
there
a
has been
minute. Dr. Anuradha will just take a minute to introduce our panelists first, and then you take up the question.
table.
We have three wonderful
Yeah.
specialists from three different walks of life and from three different states. First is my another best friend, Dr. Arshi Iqbal. He is an infertility and IVF specialist from Kota, the state of Rajasthan. Dr. Arshi, welcome on board. Can you
Thank
just
you, Dr.
introduce
Sima.
yourself?
Yeah, I'm Dr. Arshif, working as a senior fertility consultant since last 20 years and working for all my infertile couples and giving good results to them, mainly working on their lifestyle, the problems
Thank
which you're
you.
going to discuss now.
Thank you so much. Our second panelist is Dr. Raj Lakshmi Wala Walkar, my third best friend, guys. And she is from Thana, Maharashtra. And please, Raj, welcome on board and
Thank you
you
so much.
introduce yourself too.
Okay, so I'm Dr. Rajlakshmi. I've been a fertility consultant for over 18, 20 years now, and I run an IVF center in the city of Thana, Mumbai. And I'm really happy to be here, so thank you for having me.
So, friends, our third panelist, I take honor in introducing. He is better half of my friend Dr. Anuradha Khar and a very renowned and a stalwart in his field, Dr. Venkatesh. He is an interventional cardiologist. And Dr. Venkatesh, welcome on board and please introduce yourself to our audience.
Thank you, Dr. Seema. My name is Dr. Venkatesh, and as you rightly said, I am not the better half, but the other half, Dr. Anuradha. And I am an interventional cardiologist. I treat patients with heart disease, hypertension. I conduct angioplasties and pacemakers and all that. But preventive cardiology is one of my passions, and I closely follow patients who are obese, who have hormonal imbalances, hypertension, etc. So I think there is some intersection in my field and yours over here. Thank you very much for inviting me here. Um, I look forward to the questions and the session.
Yes. So, people who are new to the show, let me introduce myself. I am Seema Pandey, a reproductive medicine specialist by profession and a poet by heart. That is my introduction. For last 2 decades, I have been treating patients, and as I told you, my life and my treatment revolves around lifestyle changes in lifestyle or prevention of any kind of disease which we can do. So over to Dr. Anuradha Khar for the question.
Yeah, thank you, Dr. Venkatesh. Can you please
Dr. Anuradha, something is wrong with your network.
men are delaying?
Dr. Anuradha, we can't hear you
You are
clearly.
not audible.
So I think by the time she is correcting her network, most likely, are you there?
Now?
Hello. Dr. Anuradha wants to ask Dr. Arshi why women are delaying their fertility in this age.
Thank you, Dr. Seema, for your question. So, the first thing which comes to our mind as we are presently in India, we are developing at a very fast pace. So, the change which has come to our society is the age of marriage. We have started changing it from 20 years, so it has become 28, 30 years, which is becoming a standard today. So there are a lot of things which are associated with age related factor, and that is premature ovarian insufficiency, which is quite common nowadays, as we are seeing in everyday practices that the egg content in the patients have decreased, and because of that, most of the patient are having infertility as a take home. So mainly the social cause late marriage. Secondly, the dietary changes. We have changed a lot from our Indian habits of food habits to we have westernized more of Western habits, and the foods have changed a lot in the past 10 years. So with this food habit change, we have had obesity as a main leading cause, which is somehow related with infertility and leading to a lot of other consequences of infertility. The third
Okay,
most important factor is the stress at work field. That is also quite associated. These three things I feel are
so
associated.
yes, Dr. Arshi, you have given obesity, diet, and stress as main causes of
Delayed
infertility
marriage.
uh, and delayed marriage. My question to Dr. Raj is, Dr. Raj, I am just focusing on the reasons why these girls nowadays they are delaying their fertility.
Um, well, see, a woman is no longer a child. She's not a wife that used to be in the 18th century or the 19th century. We have gone ahead to making sure that our women get empowered. And with empowerment, so that includes things like getting them to be better educated, getting them to be financially independent. And obviously, where a child comes into a family, the woman likes to be, likes to think that she's also an equal provider for the child. So, starting with her, education that girls initially parents would not even send them to school. Now that they're learning, they're like becoming graduates. By default, the marriage age that used to be in like the past, 16, 18 years, obviously legally it came up to 21 now. And then because girls are studying and they want to take a job, they want to earn a little bit, want to do their masters or whatever, that got pushed slowly to about 37. Then the cost of living went up, so you needed two earning members. So the girl also thought कि okay, घर चलाना है, बच्चे को ठीक तरह बड़ा करना है, let both the people earn. So then you had these two couples trying to settle their life, and therefore they then took a decision to postpone fertility further. So धीरे putting all these factors together, I think we've seen that the the choice to become a mother is being delayed voluntarily, and that is what is happening. Yes, there is a plus side for it for a society because you have a much educated, social milieu around you. You have women who are more independent, who are financially more independent, who can speak their mind and so on and so forth. The downside, if any, is probably only from our point of view as fertility experts. Because when they come to us, they start aging, they start losing their ovarian reserve, and it's like you, me, Anu and Archie, who
So,
end up losing our sleep in the night. How do we get her pregnant now? And
Yes,
so
yes.
yeah, so with everything, you have give and take in life. What you have gotten
Okay.
here is a much more empowered woman, a much more progressive, focused family, but at the cost of their fertility
family.
potential on the other hand.
So, Dr. Raj, I'll cut short this question here. So, according to you and Dr. Arshi, the reason मैं अपने हिंदी दर्शकों के लिए जो लोग इस से जुड़े हुए हैं, मैं बताना चाहती हूँ कि डॉक्टर राज और डॉक्टर अर्शी ने मिलके हमें ये बताया कि औरतें प्रोग्रेसिव हो रही हैं, हम एडवांस फैमिली की तरफ बढ़ रहे हैं, हम अपनी लड़कियों को भी उतना ही एडुकेटेड एंड एट बेस्ट देखना चाहते हैं जैसा हम अपने लड़कों को। और सिंस हमारी बायोलॉजिकल क्लॉक एंड करियर क्लॉक हमेशा एक दूसरे से कॉन्ट्राडिक्टरी रहती है, कॉन्फ्लिक्टिंग रहती है, तो उस रीजन की वजह से डॉक्टर अर्शी का कहना है कि बाय द टाइम ये महिलाएं हमारे पास आती हैं फर्टिलिटी ट्रीटमेंट के लिए, उनके अंदर अंडे कम हो जाते हैं, और ये सारी पढ़ाई लिखाई करियर बनाने में उन्होंने खाना पीना, जंक फूड, वेस्टर्न स्टाइल ऑफ डाइट और करियर, मैरिज, सब कुछ टू प्रूव देमसेल्व्स का स्ट्रेस लेके अपने आप को पूरी तरह से एग्जॉस्ट कर लिया होता है। और ये सारे रीजन होते हैं जिसकी वजह से आज की तारीख में महिलाओं और पुरुषों दोनों में फर्टिलिटी कम हो रही है। तो अब आई हैंड ओवर टू अनुराधा। डॉक्टर अनुराधा इज वेरी मच among us now. I hope you take over from here.
Yeah. So aging is a big factor, as we all know. 35, more than 35, there's a problem with the decreased, diminished ovarian reserve starts happening. And then by the time they get married, say at 36, 37, and try to have a child, it gets difficult. Also, now we are seeing more and more alcohol being consumed by our by everyone, and smoking. There is a lot of drug abuse around us. So all these factors also affect the fertility. Now, paternal age, I would like to tell that it increase if the father is older, it can lead to autism, schizophrenia, bipolar disorders, achondroplasia in the baby. So it is very important for us to have the child at the right time, and including the semen parameters. Everything will decrease, the volume, the count, the motility, everything decreases. Now, coming to the nutritional part of it, we are seeing more and more obesity around us. I would like to ask Dr. Venkatesh that what do we do about these obese patients? Because for us, normal weight patients fare better as far as fertility treatments are concerned. They conceive, the implantation rates are better, the fertilization rates are better, and the pregnancy loss is less. So, can you please tell us that how do we go about this obesity, regarding the diet and weight loss and exercise?
Thank you, Dr. Anuradha. Now, the thing is that we are in a completely different kind of environment. You are infertility specialist. I'm a cardiologist dealing with lifestyle diseases. But then there is an area of intersection. When you talk about infertility, I think a significant number of them come to have infertility because of PCOS or at least indirectly connected to metabolic syndrome. And that is where I think there is an intersection between what I do and what you do. While obesity itself is a problem, there are always other factors. For example, when you talk about metabolic syndrome, which directly and indirectly contributes to infertility, insulin resistance becomes an important aspect. So when we talk about taking care of obesity, we are also talking about targeting insulin resistance, pre-diabetes or overt diabetes, hypertension, and lipid abnormalities, which is what constitutes the metabolic syndrome. And I'm sure when you're talking about pregnancies delayed because of professional commitments, many of our young people are already on the verge of getting into these problems. So when I look at patients who are overweight and have lifestyle diseases, I have two strategies to talk about. One of them is diet, and another of them is exercise. So let's start with diet. The basic problem is that there is insulin resistance in many of our patients who are obese or have metabolic syndrome. There is a chicken and egg situation. Some people argue that insulin resistance comes because of consumption of excessive carbohydrates, consumption of refined carbohydrates. On the other hand, there are some scientists who believe that insulin resistance is already there and it is only worsened by excessive carbohydrate consumption. Either way, I suppose that carbohydrate consumption and insulin resistance are related between them, and therefore reduction in total carbohydrate consumption, abstaining from refined carbohydrate consumption. So these are some of the most important interventions, one which I advocate for patients. So low carb diet. There is another aspect of dieting which we talk about, which is called as intermittent fasting. If we look back to about 150 or 200 years of Indian culture, we'll all realize whether a person was a teacher or a priest or a farmer, there were only two meals. People would have lunch at about 9 o'clock or 10 o'clock, and then dinner at about 7 o'clock or so. This whole concept of breakfast being intervened into our diet, and people talking about breakfast being a very important meal in our life, and therefore three meals, and of course not to mention the snacking in between, these have all added to the worsening of our increased carbohydrate intake, therefore hyperglycemia and insulin resistance. So the second aspect of dieting, which I talk about generally to my patients who are obese and who have metabolic syndrome, is to incorporate what is called as intermittent fasting. We should get on to a two-meal pattern like our ancestors, and try and keep a gap between the meals so that there is enough time for metabolism to happen. When it comes to obesity, I believe diet is a very important aspect, and we should target reduced carbohydrate intake, reduced processed carbohydrate intake, and intermittent fasting.
Thank you, Dr. Venkatesh. There is a trivia that, as you rightly said, it's like egg and chicken situation. Insulin resistance is a very ancient trait, was introduced in our body as a mutation to prevent our people from dying from famine and less food, especially in women, as they were looking after the children and elders in the family. And in the era of hunter gatherers, when men were out hunting for the food, it was a trait to prevent the death from hunger, and second thing, to decrease the fertility, so that this woman could take care of the child for longer time. She's not dying from the perinatal complications. But in this era, it is a paradox. For example, polycystic ovarian syndrome is a paradox to this situation which we are facing, where the food has become very refined and work condition are extremely good. Everything is at our fingertip. So, since we are having ample of food, it should go away, but it's not going. And as you said, that our ancestors, especially in our country, the two meal and that too with sunrise and sunset was something. Apart from this food and exercise, there are certain more things I would like to ask Arshi. Whenever you are counseling your patients regarding their lifestyle modification, do you most of the we the infertility specialists, I don't know about Dr. Venkatesh, we are talking about diet and exercise because it has become very popular and common thing to talk about. We sometimes talk about behavioral therapy. Are we taking care of their sleep pattern? Are they sleeping adequately? Are they the biggest reason of this stress and weight gain also comes from this lack of sleep? So what are those other factors apart from this diet and exercise you are asking your patients to do, to
Dr.
follow?
Seema, this is very important because there is somewhere or the other depression is there in between, and that person, that female is usually having some depression factor, and the I usually counsel and see whether their interpersonal relationship is good or not. Most of the time, the females are complaining about the males that he doesn't listen to me, he is quite dictator, he is that and that. So it is very important to counsel the couple that they should have some harmony between them, because somehow at the back of the mind the patient is getting stressed, the stress of treatment in itself is too much, and the household stress is also there. So counseling in this part for the couple is something very very important. Diet counseling definitely yes, exercise definitely yes, but that works when the female is happy and the stress factor is less, because somehow the person is eating munching because of all these depression and stress. She feels that she will be not saying this to the family, she just take out everything. Like few people are shopping in the when they are stressed, so these people mostly are eating because of stress. So you have to, if you need a psychologist also, it is really important sometime to have a consultation with a psychologist also for these particular patient, because this is also there.
I have a point to make that um, women who are working for long hours, they are stressed, especially the IT sector in Bangalore. The consumption of caffeine, coffee, has become too much. And it is shown that if you drink more than 5 cups of coffee a day, that's around 500 milligrams, it will delay the fertilization of the egg and even the implantation. So you get the delayed pregnancy in such female just because of coffee also. Also, I would like to now ask Dr. Venkatesh, is exercise more important or is diet more important, or we have to do it together?
Or the
And
Well,
household environment
if
more important?
we do together, what kind of exercise do you advise?
quickly, whenever we talk about lifestyle, when we say that we have to improve your lifestyle, what comes to our mind, a typical person's mind, is a park, a girl in a ponytail with her earphones, a Garmin, and running. I beg to differ. I think when it comes to lifestyle to improve weight control, lifestyle diseases, 90% of his diet. And as Dr. Seema rightly pointed out, there was a time insulin resistance was protective to human beings when there was scarcity and famine. But now, with abundance of food, especially the refined carbohydrates and processed foods, this is no longer relevant. So, we are overburdening ourselves with food that releases insulin resistance, and leads to much of our lifestyle related diseases. On the other hand, exercise is important. Exercise makes us fit, exercise makes us feel good. And there are certain hormones like endorphins, and I'm sure there are so many others which your textbook of Spiroff will mention, that would be released by exercise. So I would give about 80-90 for diet and 10-20 for exercise. But then, what are the exercises which we should do? We typically think about exercise as aerobic exercises, but I believe that there has to be a mix of aerobic exercises and strength training. When we talk about aerobic exercises, we are talking about walking, jogging, skipping, rowing, swimming, dancing, and all of these things. These tend to burn calories, but when we build our muscles and we make our muscles stronger, the same aerobic exercises will help us lose calories more efficiently. Also, better muscle strength leads to better bone strength, and it helps us in many of our activities, especially when it comes to conception, pregnancy, delivery, etc., and also postpartum period. So, therefore, I think there has to be a mix. Typically, I advise my patients to do 3 days of aerobic exercise. You walk or jog or whatever you want to do for 3 days, and the remaining 3 days as strength training. Women have this resistance to a concept of strength training because they think that it will build their body and start looking, big biceps and all that stuff. When we mean strength training, it is not about building muscle. That's a different concept altogether. We are talking about toning the muscles, strengthening the muscles so that the metabolism in the muscles is better. So you could have lightweight or medium sized dumbbells or barbells. You can even go to the gym and exercise using the bench press, etc., but at lower weight categories. Typically, when you go to a gym, the gym trainers tend to push people, and these have led to a lot of mishaps. There have been gym deaths because men have tried to push themselves in the gym. And also there is a unnatural push towards supplements to make people healthy. I would suggest everybody to refrain from that. So technically, when we talk about exercise, we are talking about 3 days of exercise, and 3 days of strength training. Some core, that is, doing something like push-ups or planks, etc. These should help. And maybe a 1 day of complete rest should be the right mix of exercise for people with metabolic diseases and obesity.
So, yes, these are the excellent points raised by Dr. Venkatesh. And let me tell the viewers that if you are doing exercise at least 6 or 7 days a week, whenever it comes to strength exercises, you have to do it on alternate day if you're opting for 3 or 4 days a week. So it shouldn't be continuous. So that, as he said, that female are scared of getting those biceps, so that will not come. You'll get enough rest to rest your body. So coming to shots, we are giving knowledge shot. I'll come back to Dr. Venkatesh. First of all, I would like to ask Raj, what are those 3 shots of food which you must include if your patient is having either PCOS or low ovarian reserve or endometriosis?
3 shots in food, right?
Hmm.
So first thing,
Yes.
reduce your carbohydrates. Two, increase your proteins. And three, make sure that your micronutrients are up to top notch. If you do these 3 things, you've done the best that you could in the given situation.
So, Dr. Arshi, I think you agree with her. Now, I would like to name of those 3 or 4 shots which in food she is mentioning for general people.
Green leafy vegetables, juicy fruits, and these eggs. If you give me three choices only.
Dr. Anuradha, let's ask you also this time. What are your 3 shots you would like to give in food?
I would say zinc, vitamin D3 supplementation. If she's deficient, it helps a lot. And I would also say that in India, our women are anemic. We should correct their anemia. So if we feel that the woman, we don't look at only the towns and the cities, we look at villages, and anemia is still a big chronic disease there. So we should correct their anemia. We should give them supplements. Vitamin D3 is mainly for the cities and the IT people who are always in their chambers, and zinc supplementation. Vitamin C also has a good role. And I was
Okay.
recently reading that methi seeds, methi leaves and methi seeds,
That's
This
good
is
for
very good.
insulin resistance,
Yeah,
preventing
even
insulin.
moringa leaves are good for the patient.
So coming back to Dr. Venkatesh, what are those, since cardiovascular health and our PCOS population's health is intertwined, as you said, that intersection. So what are those things in your diet which you just focus on? As you said that 90% of the things are related to your diet. So what are those three micro and macronutrients, especially micronutrients and mineral, you focus on and you ask your patient to as a must to
Well,
have it?
to me, it is not about what you should take. It is more about what you should not take. So there are three
Not take.
aspects we are talking about. The first one is carbohydrates, the macronutrient. Reduce the amount of carbohydrates you take, reduce the amount of refined carbohydrates you take, and reduce the amount of processed food you take. Second, increase your proteins and fats. And I agree with Dr. Arshi, majority of us can take, even vegetarians, sometimes as medicine, can take eggs. Eggs are a completely biologically good protein and fat source. So you could talk about increase in protein and fats, and egg will become a very important thing. So this is the second one. The third important factor in nutrition, which I talk about, is time. I think we must give enough gap between the meals. As you rightly said, our ancestors had sunset food and sunrise food. So there was at least 14 to 15 hours of gap. This is basically the, and also culturally in all our religions, whether it is Hindu, Christian, Muslim, Jains, there is a factor of fasting due to various reasons, and this helps us to build our metabolic strength. I think time, as to how you time your meals, stopping snacking in between. So all of this becomes an important. So I would say three factors which are very important for me when I advise nutrition is carbohydrates reduction, proteins, fat increase, and time. Keep a gap.
I would last question. I would. I am again interfering in between your talk, Doctor Venkatesh. This anti-inflammatory origin of the diseases concept. We are taking obesity as a pro-inflammatory status, polycystic ovarian syndrome as a pro-inflammatory status. So is endometriosis, and so many things. So there are different dietary concepts: anti-inflammatory diet, dash diet, Mediterranean diet, this diet, that diet. As a cardiologist, we have discussed so many things, and nowadays people are so much Google friendly that they are just going and just typing fertility diet, PCO diet, heart diet, and they are getting all these things. What is your take on those diets?
I suppose for commercial purposes, people have keto and paleo and GM and all of those things which you mentioned. But I think the fundamental basis for good health is carbohydrates, and we know carbohydrates, and especially the refined carbohydrates, are pro-inflammatory. We take more carbohydrates, there is secretion of insulin. The more insulin that gets secreted, the cells become resistant to that. On one side, it leads to adipogenicity. The adipose tissue in skin and abdominal fat actually leads to hyperandrogenism, and that's one of the basis for your PCOS. About 40% of your infertile patients. On the other hand, the metabolites of insulin, the post metabolites of insulin, are the ones which are pro inflammatory. So we know that if you measure things like high sensitivity, CRP, etc., in these patients who are consuming excess amount of carbohydrates, there is an inflammatory state. And when we reduce carbohydrates and increase proteins and fats, we see that these things settle down. So yes, I agree with you. Inflammation is a very important thing, but is a basis of other lifestyle diseases like atherosclerosis and hypertension as well. Overall, I think the important thing is having a anti-inflammatory diet. You name it, anything. We don't care. If you have a lot of money, you go to a very high cost coach. do whatever they say, but as long as you stick to this fundamental principle of reducing refined carbohydrates and total carbohydrates, I think should be good.
Doctor, can I ask one question? If at all, alcohol somebody drinks, how much is allowed? I mean, without any problem. I'm sure many
So,
of the patients want to know this from you.
fertility rates are
Do
higher.
you say no to alcohol, or you allow them little allowances, weekends?
well, this
So,
question comes up when patients have had a heart attack and they come back and ask us that we have heard that alcohol in moderation is cardioprotective. I think it's a scam. I don't think there is any such thing exists. There are people talking about French wine being, heart friendly and all that. So I don't think such a thing exists. So what happens when patients come to me? You have somebody who's drinking every day, and when they come to us and ask, "Can I drink?" I'd say, "Yeah, reduce it, make it weekends, don't binge drink." On the other hand, if someone comes who's a teetotaler and say that some of my friends said, if you drink alcohol, my heart is going to get better, I say never start, because you never know what happens to you once you start. You may become an alcoholic. So, alcohol at even smallest quantities has detrimental effects, and especially in women in the age of fertility, it definitely is going to cause a lot of problems, not only metabolically, but also the reproductive health becomes a problem. So, therefore, it is it's not allowed. But if someone is drinking very heavily, to ask them to drink less is not the same as someone who is not drinking to drink. So that's my philosophy when I'm advising. So alcohol in all its forms and all its quantities is harmful to the human body. So if you're drinking a lot, cut down. If you're not drinking, don't ever start.
Thank you. So, since we are running late now, I'll just try to wind it up by asking one question each again. So, I'll start with Dr. Raj Lakshmi Valavalkar. Dr. Raj, what is one thing which you tell your patients of infertility to follow religiously regarding their lifestyle?
so basically, diet and diet and diet, because you are what you eat. So if you are going to eat
Great.
your diet properly, you'll get your nutrition, you'll get your proteins, because proteins are the building blocks of life. So you need those proteins in you. You need carbs to be less. You reduce your carbs, your metabolic syndrome is going to go away. And you take your nutrients. See, the mother needs to eat, because she not only needs to get pregnant, but she make provisions for the 9 months, the breastfeeding, and prepare herself for the next baby after that, if she wants one. And
So,
therefore,
Dr.
diet is
Arsh,
absolutely.
Well, my what mainly I follow is plenty of water. That is most important according to the season. Half an hour of walk religiously, and good sleep, at least minimum 8 hours at night. And rest
ex-
what food is. Food so definitely, yeah, low
excellent.
carb.
Anu, I would like you to just conclude whatever we have discussed till now, and then I'll be translating in Hindi quickly, and then we'll say goodbye
Okay.
for today.
So, lifestyle modifications are very important in obese patients. Not that they are not important in lean PCOS patients. There also, we should tell them that don't gain weight and increase your muscle mass. That is the new thing in that. Now, again, with diet weight loss has to be done for obese patients because it brings them nearer to getting pregnant. Diet plays a major role, almost 80 to 90%. Low carb, high protein diet. They can take little bit of fat unless they have too much of lipid profile has gone very. Now, exercise again, every weekly thrice, they should do cardio training and 3 days a week with their weight training. Plus, they should supplement themselves with micronutrients, vitamins, vitamin D3 if they are deficient. Now, thyroid, we have to look into. Patients should take their thyroid medicines regularly if they are hypothyroid. That also causes a lot of problems. And most important, what I tell my patient, have positivity in your self. Believe in yourself, be positive, de-stress yourself either by meditation, yoga, or if you are stressed at work, take a short break. If you are too much stressed and you can afford to work from home, I tell them, because I deal with mostly IT, because the stress of traveling and office politics, that all is avoided. So this is my take on today's
थैंक यू डॉक्टर अनु। तो यहाँ पे मैं थोड़ा सा और एक जोक ऐड कर देती हूँ। फॉर रिक्रिएशन प्लीज डोंट डिपेंडेंट ऑन योर गैजेट्स, गो बैक होम, stay with wife, just make a good environment so that that is conducive for procreation too, along with enjoyment. A friend of mine keeps saying our ancestors at the end of the day used to go back home, they didn't have company to or their phones to play with, so they used to play with each other. So that is the most important thing. If you want that conception occurs naturally, things should be going naturally, guys. So for that you have to take pains, you have to work for it, and you have to create it. तो दोस्तों, आज हमने इन चार महान हस्तियों के साथ अपने लाइफस्टाइल के बारे में बात की। उस लाइफस्टाइल से हमारी फर्टिलिटी पे कैसे प्रभाव पड़ता है और हमारी इन जनरल हेल्थ पे कैसे प्रभाव पड़ता है, क्योंकि मैं आप लोग को बताती रहती हूँ कि हमारी फर्टिलिटी और हमारा चाहे वो बीपी हो, शुगर हो, हार्ट हो, ये सारी चीजें आपस में रिलेटेड है। इन सब के लिए हमारे कार्डियोलॉजिस्ट के पास एक आंसर था कि हम समय से खाएं, सुबह 2 मील से ज्यादा दिन में ना खाएं, दिन भर स्नैकिंग ना करते रहे। मैं रहती हूँ एक गांव में और यहाँ का जितना फास्ट अर्बनाइजेशन होता है, यहाँ के लोगों से मैं कहना चाहूंगी कि आप जैसे आज से 20 साल पहले थे बहुत अच्छे थे, वैसे ही खाइए, अपने को वेस्टर्नाइज मत कीजिए। टीचर्स की लाइफ सबसे अच्छी लगती है, 9 बजे खाना खा के स्कूल जाते हैं और उसके बाद से शाम को खाते हैं, वैसे ही कीजिए, हमारे पूर्वज वैसा किया करते थे। आप अपने आप को फिजिकली एक्टिव रखिए, आपके खाने में चावल और रोटी की मात्रा कम होनी चाहिए। दाल, जितने प्लांट बेस्ड प्रोटीन है वो पूरी दुनिया में साबित हो चुका है कि एनिमल बेस्ड प्रोटीन, और एनिमल बेस्ड प्रोटीन में मिल्क भी आता है, उनसे फार फार बेटर होते हैं। जब आपकी एग और स्पर्म क्वालिटी की बात आती है, तो जो हमारा इंडियन फूड है, प्लेटर है, उसमें हमारे दिन के खाने में दाल या सांभर होती है, हर स्टेट में अलग अलग नामों से, उसको इंक्लूड कीजिए। सैलेड खाइए, सीजनल वेजिटेबल्स खाइए। ऑफ द वे जाकर के अमेरिका से क्विनोआ मंगा के खाने की बिल्कुल भी जरूरत नहीं है। इंटरमिटेंट फास्टिंग करिए, रात का खाना 7 बजे तक खा लीजिए, सुबह का नाश्ता की जगह 9 से 10 बजे डायरेक्ट एक प्रॉपर मील लीजिए, बीच में भूख लगे तो पानी पीजिए, चाय कॉफी का कंजम्पशन कम कीजिए। अल्कोहल एक ड्रॉप में भी उतना ही खतरनाक होता है जितना बहुत सारा। तो अल्कोहल ना कार्डियो प्रोटेक्टिव होता है, ना पीसीओएस को रोकता है। आज मैंने एक आर्टिकल पढ़ा जिसमें वाइन पीने की सलाह दी जा रही थी पीसीओ ठीक करने के लिए, ऐसा बिल्कुल नहीं है। दे हैव ऑप्टेड इट फ्रॉम मेडिटेरेनियन डाइट। Mediterranean diet includes that wine. It is not because that diet includes that part of the world is very cold and that is their custom, so that wine is included in that. That is not the part of Mediterranean diet जिस जो हमें लेना है। ओमेगा 3 फैटी एसिड की जरूरत हमें है, प्रोटीन की जरूरत है। फिश खाइए ढेर सारा, कोई बात नहीं, आई एम नॉट आस्किंग यू टू बिकम वीगन। स्ट्रेंथ एक्सरसाइज एंड एरोबिक एक्सरसाइज ऑल्टरनेट करिए, और ये सारी समय से सोइए, 7 से 8 घंटे की नींद लीजिए, और जरूरत पड़ने पे अपने डॉक्टर से मिलिए। अगर आप इतना सब कुछ करेंगे तो यू विल बी हेल्दी फॉरएवर। आज के लिए इतना ही। टू माय डॉक्टर्स कॉलीग, आई होप दिस नॉलेज शॉट वाज यूजफुल, एंड टिल we come back again with another point topic. Bye bye, goodbye, good night, Shabba Khair. And
Bye-bye.
thank you, my
Namaste.
moderator, Dr. Anuradha Khar, and my wonderful panelists, Dr. Venkatesh, Dr. Rajlakshmi Valavalkar, and Dr. Arshi Iqbal.